have the pleasure of introducing her. She is the Associate Professor in the Department of Epidemiology at the Millman School of Public Health at Columbia University. As a cancer molecular epidemiologist, Dr. Llanos examines molecular and sociological factors that contribute to increased breast cancer incidence at younger ages, increased incidence of more aggressive tumors, and increased mortality among Black women. Relevant to beauty justice, her ongoing work includes investigating associations of personal care product use, especially hair products, with breast cancer. So during this session, she will highlight findings from the Women's Circle of Health study. Dr. Llanos, welcome.
Hi, thanks so much for the introduction, and it's an honor to be here to share some of the research that we've done. I'm gonna pull up my slides. Okay. All right, so I'm going to be discussing basically, our interest in examining hair products, specifically permanent hair dyes and chemical relaxers and straightening products with the risk of breast cancer. And I don't want anyone in the audience to feel, stressed out or nervous. I think it's important that we share this type of information. And as Dr. Teteh and Dr. James Todd mentioned, I think the point is we should start thinking about what we can do to address these exposures and potentially reduce our risk for poor health outcomes, whether it's maternal outcomes or cancer risk. So we've discussed that there are harmful chemicals in personal care products and especially hair products. Some of these products have been linked, or some of the chemicals rather, have been linked to mutagenic and carcinogenic processes, meaning that they can cause harm or damage to our DNA, and that can contribute to cancer risk. We've also discussed endocrine disrupting chemicals, including phthalates and parabens and other chemicals that interfere with normal hormonal processes in our bodies. I am interested in the endocrine disrupting chemicals in a variety of personal care products and hair care products specifically. But I feel like we've talked a lot about the endocrine disrupting chemicals and less so about the carcinogenic compounds. And really, we don't know exactly what all of them are. And I think that's one area that we can do more research, more collaborative research to really understand what these chemicals are, why are they in these products? Can we get them out of these products? And how can we help reduce risk? So we've discussed, or we've heard from Dr. James Todd that there's a greater burden of endocrine disrupting chemical containing products used among Black women, especially greater childhood use. And the prevalence of hair products, just the distribution of these exposures differ. When we think about hair dyes and its association with breast cancer, most of the studies up until a few years ago, most of the studies that have linked the relationship between hair dye use and breast cancer have been done primarily in white women. And we're now at a point where there have been studies, including data from the Women's Circle of Health study, which I'll get to in a second, but emerging evidence is showing that although Black women use hair dyes at a much lower rate than white women, we still see an association between hair dye use and cancer risk in Black women. So we know that chemical relaxer use is substantially higher in Black women. So Black and African-American women in the US, in the studies that have examined the prevalence of use, studies have reported use as high as 90% of study samples for US-based samples. In Ghana, so in West Africa, there is also a very high prevalence of chemical relaxer use. 94% was reported in one study. Conversely, in East Africa, in Kenya, there was one study that reported chemical relaxer use in about 60% of women. So as more data, as we generate more data in Black women and in other women of color, we'll really understand how these different exposures and also characteristics of product use might be impacting our cancer risk. So let's see, my slides are not, oh, here we go. So there is a growing body of evidence around endocrine disrupting chemicals and the fact that it can act on human cells through a variety of mechanisms that enable the hallmarks of cancer. But also, as I mentioned, in addition to the endocrine disrupting chemicals, there are other toxic chemicals as well. I wanted to also point out, we've been talking a lot about hair products, but skin lightener use is another type of product that is primarily used in women of color and at very high rates, and are also associated with poorer health outcomes. There was a study in Ghana that recently showed that higher levels of skin lightener use and hair relaxer use in postmenopausal women was associated with altered estrogen metabolism. And the findings were particularly striking for lye-based relaxers. So, a lot of the work that I've been doing so far has focused on Black women in the US and even white women in the US, but I think we also need to consider other populations, other Black populations and African ancestry populations across the globe that are also exposed to these products. And their products could be different. We just don't really know. So given this relationship with altered estrogen metabolism, there's more and more mounting evidence of the potential relationship between using these products and increasing the risk of hormone-related cancers. So long-term and short-term studies are needed to really understand all of the impacts of a variety of chemicals that are found in these products and their impacts on our breast cells. And I would say just cells throughout the variety of organs in our bodies, because as I get through some of the data, we're also seeing a relationship between hair dye use and other cancers, not just breast cancer. So moving on to some of our data from the Women's Circle of Health study, I just wanted to describe the study design first. So this was a case control study that was started in New York City and 10 counties in New Jersey. And the counties were selected because they had very high populations of Black and African American women. So we had over 2,200 women diagnosed with breast cancer that enrolled in our study. Most of them were Black, and we also had over 2,000 healthy controls. So these women were not diagnosed with any cancer prior to enrolling in the study. We used in-person interviews and we collected anthropometric and body composition measurements. We used questionnaires to assess hair product use. So we were interested in permanent hair dye use, chemical relaxers, and cholesterol or placenta-containing conditioners. We were also interested in not just whether or not these women were using these products, but we wanted to know, when did they start using them? How long were they using these products for? Were they applied, in hair salons or at home? So we were really interested in starting to collect detailed information on hair product use and the variation of use across our study participants. We also collected pathology records so that we could review the records to characterize the tumor characteristics. One of the interests in my lab is really to understand why Black women, especially younger Black women, are diagnosed with more aggressive tumor features. So we've looked at a variety of different exposures in association with these tumor characteristics. So we use a variety of different logistic regression models in the case control analyses to just investigate whether there was an association between hair product use and the risk of breast cancer in both Black and white women. So the first thing we did was to look at the prevalence of use of different products. And from this bar graph, you can see that hair dye use is twice as high in white women relative to Black women. So in white women, in our sample, about 60% of white women used hair dyes. And this is again focusing on permanent hair dyes, while only 30% of Black women used these products. But when we look at chemical relaxers, it was 88% of Black participants responded using chemical relaxers. And about 5% of white women also used those products. We also assessed deep conditioners, specifically those that contained cholesterol or placenta, because they would be the types of deep conditioning products, especially those that you rinse off your hair, that would contain, some harmful chemicals, especially the endocrine disrupting chemicals that we've been talking about. So we see among Black women about 60% reported use of those products and about 7 to 8% in white women. The remainder of the talk will focus just on hair dyes and relaxers, because there were some issues with some of the respondents actually distinguishing between some deep conditioning products and whether or not they contained the chemicals or the cholesterol or placenta that we were really interested in. So in our very first analysis, we found that the history of, so among women reporting that they regularly dyed their hair using permanent hair dyes, just having that history of use was not statistically associated with an increased risk. So there really was no association. But as we look deeper into some of the characteristics of hair dye use, we found that among Black women, those reporting the use of dark shades of dye, so dark brown dyes and Black dyes, there was a 51% increased risk of breast cancer. This association was not statistically significant among white women. We also wanted to know whether there could be potential differences in the association based on the types of products. So consumer products that we can just buy off the shelf might be different than salon products, just based on the fact that when you go to a hair salon, it's a licensed, trained cosmetologist that actually knows how to use and apply these products. Well, interestingly, we found that women reporting having their hair most frequently dyed in a hair salon had increased risk. So it was about 26% increased risk. And that was in Black women reporting having their hair dyed in salons. And again, we didn't see this association at all in white women. Here we're looking to see if there were potential differences in the relationships between hair dye use, and again, the shade of dye being used, and the application of hair dyes, and if there were associations with ER positive, so tumors that express the estrogen receptor, ER negative, so tumors that don't express the estrogen receptor, and triple negative subtype, which is a subtype that is the most aggressive form of breast cancer and also most common in Black women. So what we found was that overall, in all three types, so all three categories of breast cancer, there were suggestions of an increased risk. So that increased risk associated with the use of dark hair dyes and salon application was consistent, but we found that it was particularly strong for the estrogen receptor positive tumors. This slide, I actually cannot see. Okay, so this is the same analysis focused on white women. And again, we're seeing that the dark shades of hair dye is associated with increased risk of estrogen receptor positive, ER negative, and triple negative disease in white women. But again, that association is the strongest and also statistically significant for the ER positive disease. And here we examined whether there was a relationship between ever use. So having a history of regular use means that at some point in these respondents, our study participants' lives, they reported using chemical relaxers more than twice per year. We found that the prevalence of use, again, was very high in Black women. And here we're not seeing a relationship between chemical relaxer use and breast cancer risk in Black women, but we do see that among white women, there was about 74% increased risk. We looked at whether it was home kits or salon kits that were associated with risk for breast cancer. And we really didn't see a strong association for either of these types or the combination of application types in Black women. But again, for white women reporting the use of home kits, there's actually a substantially, more than twofold increased risk of breast cancer. And lastly, we examined the combination of using both hair dyes and chemical relaxers. And for white women, we again see this more than twofold increased risk for breast cancer. So we did a subsequent analysis. So that first, the data that I just presented to you, we published in 2017. And in a follow-up analysis where we focused only on breast cancer cases in our study, we looked at the relationship between variety of characteristics of hair dye and relaxer use. And we found that combination application, so these are people with combination application are those that reported using home kits, so DIY relaxers and hair dyes, as well as having a salon professional apply these products to their hair. And what we found was that this type of combination application was associated with more than twofold increased odds of higher tumor grade. And so that was true for both for hair dye use, but also when we looked at combination application for relaxers, we're seeing more than two, or at least twofold increased odds of larger tumors. And the other thing that we found that was interesting, so we were interested in whether using these products before puberty was also associated with increased risk. And what we saw was that longer use, so women reported using relaxers for more than 10 years, and those that reported using the products before age 12, which is about the time of pubertal development, we found that there were significantly increased odds of larger tumors. So from this analysis, we this analysis is among the first to document relationships between the use of permanent hair dyes and chemical relaxers with more aggressive tumor features. I just wanted to highlight that since our first publication from the Women's Circle of Health study in 2017, there have been several other studies that support the relationship between chemical relaxer use and hair dyes with breast cancer. So in a study from the Black Women's Health Study, which is a study of over 50,000 Black women in the US, after almost 18 years of follow-up, they identified over 2,000 incident cases of breast cancer, and they found evidence that heavy use of lye-containing relaxers might be associated with increased risk of ER positive breast cancer. So the findings were marginally significant. So the confidence intervals spanned 1, but just by a little bit. So this evidence, we really need more evidence to confirm this relationship. But I think the accumulation of all of the evidence that exists is pointing towards a relationship. So the sister study, which is a study of women who themselves didn't have breast cancer, but they had a sister that was diagnosed with breast cancer. So they followed the sisters of breast cancer survivors forward in time. And after about 8 years of follow-up, they also identified over 2,000 incident cases of breast cancer. And this study found that any straightener use, so any type of chemical relaxer or chemical straightening product use, was associated with increased risk of breast cancer. They also found personal use of permanent hair dye. So again, hair dyes, similar to what we found in the Women's Circle of Health study. So this is now 2 studies in addition to ours that is reporting consistent increased risk. So the sister study has also now published on the relationship between hair product use and ovarian cancer, which is another hormone-related cancer. And they also are finding that frequent use of straightening products and relaxers and even other types of pressing products might be associated with an increased risk. So for the frequent users, so women reporting relaxing their hair for more than 4 times per year, they had double the risk of breast cancer than women not using these products. And a similar finding was observed for the use of permanent hair dyes, but specifically with an increased risk of the non-serous subtypes of ovarian cancer. So I want to mention, we've been focusing a lot on women's health, but a recent publication just published earlier this year actually demonstrated an association between hair dye use and prostate cancer risk in men. The one thing that I'll say about this study was that it did not include Black men, but that clearly is, an analysis that we need to do because Black men also dye their hair, Black men also use personal care products. So just to understand those exposures and the potential relationship with prostate cancer risk, I think would be really interesting to do. But prostate cancer is another hormone-related cancer. So again, this is adding to the evidence that using these products could be contributing to increased risk. So I just want to wrap up. There is lots of emerging data that support exposures to chemicals, including endocrine disrupting chemicals and other harmful chemicals in hair products as risk factors for breast cancer and other hormone-associated cancers. So the thing to consider is even at low concentrations, these chemicals can impact the endocrine system, and longer-term exposures are those that we really have to think about, not just for cancer, but just overall health. And it's the timing, the dose, the duration, the characteristics of product use throughout the life course is really important. So making sure that we can assess these exposures at critical windows of susceptibility, but also understanding the prevalence and patterns of use so that we can develop interventions that can address some of the exposures that we're seeing in vulnerable communities. And I'll just mention, we're all interested in really understanding all of these relationships and understanding how we might improve health outcomes. So we need more research, and I think The point that Dr. James Todd brought up about not just continuing to document these associations or documenting these issues, but finding ways that we can reduce the potential associated risk in vulnerable groups is definitely, these are the next steps that we really need to be thinking about. So again, more studies are needed to clarify these associations. I would say, in addition to using questionnaires, we need to, do analyses of biomarkers so that we can have, more information, more molecular data to say, these are the chemicals, this is what the chemicals are doing in our bodies, and this is why we really need to make better choices about the products that we're using. And I think an important aspect of that is educating consumers and giving them resources so that they can make better, safer choices to help reduce their risk and mitigate some of the potentially adverse health outcomes associated with these exposures. And lastly, advocating for policy change is a critically important strategy, because we really need to remove the toxic chemicals in these products, the toxic chemicals that we know shouldn't be in these products, toxic chemicals that we don't find in products sold to consumers in other countries, like in the EU. So I just want to acknowledge investigators, all of our staff members and students who've worked on these projects with us, and all of our other ongoing work, our funders. And I definitely want to acknowledge the Bench to Community team for an amazing symposium and just a really important area of research that, that you're contributing to addressing really important topics in our communities. And I'll end here. Happy to take questions if there's time. Thank you.
Thank you so much, Dr. Llanos. That was very striking data that you presented, and even more so the combination. I think that's something you mentioned that we don't think about. And to see how much of a difference it's making with potential breast cancer increase or tumor increase that's amazing. And so the work that you guys are also doing as well is bringing more awareness and also helping us to make better choices as consumers. So thank you as well. I do have one question for you. This is from a former student of yours, Amber. She has mentioned that you mentioned a study from Ghana citing hair relaxer use and skin lighteners. So she is Jamaican and Ghanaian, and she is asking that she knows that these products are typically rooted in white beauty standards resulting from colonialism. So she's curious if your research, if you found any discussion of attitudes towards such product usage in West Africa or the Caribbean versus when a person immigrates to the US.
I think that's an amazing question. Hi, Amber, thanks for joining. So we actually have not done that yet, but that is actually a topic that I was recently awarded a grant to look at in Kenya. So I mentioned that there was one study that suggested that among Kenyan women, like 60% use chemical relaxers, but one of the same sort of bench to community, the purpose is that community members have raised these questions. Well, women in Kenya are raising these questions. And so my collaborators and I are actually going to look at that and consider the standards of beauty and why certain women relax their hair and others don't, and why they use certain products and not others. But I do think that, when I was talking about the Ghanaian study, I think we really do need to start looking at other African ancestry populations to understand some of these contributors to product use. A lot of it has to do with Eurocentric ideals of beauty. But I think, as we've seen in the past 5 to 10 years, we're moving more towards natural hair and a natural hair movement. But the unfortunate thing is there are some products that we think are natural that also contain harmful chemicals. So we really need to understand sort of the combination of all of these things and what these chemicals are in a variety of different products.
Definitely agreed. Thank you so much again for sharing your data with us today.